Did you know that the average life expectancy of an American in 1900 was 47 years old, with children being nearly a third of all premature deaths? According to Frontiers of Public Health, infectious diseases such as smallpox, diphtheria, measles, and tuberculosis were the primary cause of death across the globe. And for those who survived these brushes with death, they were left with devastating complications or suffered lifelong disabilities associated with the effects of these illnesses. They included blindness, deafness, neurological damage, or even paralysis. Vaccines, along with the improvements in sanitation, hygiene, and food safety during the 20th century, have increased life expectancy to 78 years as of 2024, a gain of more than 30 years. Today, I will explain the historical effectiveness of vaccine programs, the efficacy of modern vaccines and vaccine technology, while also highlighting the damage caused by vaccine skepticism in vulnerable populations in America. Vaccine programs have been historically successful for over 2 centuries. Montero and colleagues state that vaccination has been one of the most transformative public health achievements in human history. They have reshaped global disease patterns. The mortality rate from infectious diseases decreased from 797 deaths per 100,000 people in 1900 to 59 deaths per 100,000 people in 1996. That was a 92% reduction in the death rate due to widespread vaccination. In that time, we have eradicated or brought under control many diseases. Smallpox, a disease that killed an estimated 300 people worldwide in the 20th century, is no longer a communicable disease, with no recorded cases since 1977, thanks to a global vaccination campaign. There have been drastic reductions in polio, a disease that paralyzed 35,000 Americans every year in the 1950s. Measles, which infected more than 3 to 4 million people, Americans annually, saw cases drop more than 95%. Vaccination has moved from early empirical practices to modern immunology. This has come with improved safety, precision, and a global reach. These historical programs show that widespread uptake, and not just vaccine availability, creates population level protection. Despite this success, the same diseases can reemerge when vaccination rates fall. As we have seen with measles, in 2019, measles outbreaks surged in communities with low vaccination rates, leading to the highest number of cases in 25 years. This demonstrates the fragility of herd immunity and the importance of vaccine compliance. We've seen the benefits of historical vaccine programs and their monumental impact on human longevity, but there are still challenges to overcome today. But what does that evidence say about modern vaccines? In a 2026 review in New England Journal of Medicine highlights the most recent data on COVID-19, RSV, and influenza vaccines. Modern vaccines are effective against three of the most common pathogens that strain our healthcare system. COVID-19 vaccines continue to reduce severe disease, hospitalizations, and deaths with up to 68% effectiveness, according to Havers et al. While not perfect, COVID-19 was responsible for over 1 million deaths. Respiratory syncytial virus, or RSV, is especially dangerous for infants and older adults. The new RSV vaccines reduce hospitalizations by 68%, a major breakthrough for a virus that caused about 60,000 hospitalizations and up to 10,000 deaths among older adults each year in the US. Influenza vaccines, which, though variable from year to year, consistently reduce severe outcomes, keeping 67% of children out of emergency rooms, and in adults, flu vaccinations reduce the risk of ICU admission by 26% and the risk of death by 31%. Modern vaccines are updated to circulating strains. This improves real-world performance, with high vaccination rates reducing transmission, protecting immunocompromised individuals, and stabilizing our healthcare system. Modern vaccines are safe, they undergo rigorous testing, and are continuously monitored. The evidence shows that serious adverse events are extremely rare, occurring at rates of 1 in 100,000 or 1 in a million compared to the risks of infection. The evidence shows that while not perfect, modern vaccine programs are highly effective at preventing serious disease. But even the best vaccines cannot protect communities if they do not receive them. This brings us to one of the most pressing challenges today: vaccine hesitancy. Vaccine hesitancy can be devastating to vulnerable populations. The research done by Matas et al. Shows that vaccine hesitancy is not evenly distributed. It clusters in underserved communities with limited access to healthcare. These hesitancies are driven by many factors: historical medical mistreatment, including unethical experiments and unequal treatment; misinformation, which spreads rapidly online; structural barriers such as transportation, lack or navigating insurance, and clinical availability; and four, distrust in institutions. These factors have direct consequences for vulnerable populations. They include higher infection, hospitalization, and mortality rates, slower community recovery after outbreaks do occur, an increased strain in an already struggling healthcare system, widening of existing racial and socioeconomic health disparities. During the COVID-19 pandemic, hospitalization rates in some underserved communities were 3 to 4 times higher than in wealthier, well vaccinated areas, with mortality rates following a similar pattern. To protect these high risk communities, we must improve access to vaccinations, strengthen communication and community partnerships. Additionally, we must acknowledge that rare adverse effects do occur, but the data shows unequivocally that they are far less common than the harms caused by the disease we are trying to prevent. And while we shouldn't dismiss these concerns, being transparent will help rebuild the trust needed to effectively roll out these programs. Vaccines have a long history of success, and modern evidence confirms their effectiveness. But vaccine hesitancy continues to endanger vulnerable and marginalized communities. We should encourage evidence based communication, community engagement, and equitable access to vaccination. Public health is a shared responsibility. Protecting the most vulnerable requires collective trust in the tools that have safeguarded us for a generation.